or any other social media platforms. We are here gathered and we are so proud. My name is Wally, and I always want to say good morning, Rwanda. I'm very privileged to have you in the house, and I'm happy today. I'm with Beauty Mushashi. Beauty, good morning, and how do you say good morning in Kinyarwanda?
Thanks, Wally. In Kinyarwanda we say mwaramutse.
Mwaramutse.
Yeah, Mwaramutse Wally.
Mwaramutse. Thank you so much. I think you are also privileged to greet the audience in Kinyarwanda so that we proceed with the program. Can you greet the people?
Of course. Mwaramutse neza, nitwa Aime Bote Mushashi nkuko Wally yaramaze kubivuga. Ningiye tugiye gufatanya kuyobora iyi nama, ndakoresha Kinyarwanda, we arakoresha Icyongereza kugira ngo buri wese uri hano utumva rumwe muri izo ndimi tugiye gukoresha abashe kumenya niki kiri kubera hano. Uyu munsi rero dutana hano aho hagiye kubera inama iyo yiga ku bijyanye n'ubuzima bwo mu mutwe ndetse n'ububata, tutibagiwe n'ihohoterwa rishingiye ku gitsina. Iyi nama irimo abantu batandukanye, harimo abashakashatsi, harimo inzobere mu bijyanye na science, inzobere mu bijyanye n'ubuzima bwo mu mutwe, n'abandi batandukanye, tutibagiwe n'urubyiruko ruri hano. Muraza gusobanukirwa byinshi ku bijyanye n'ubuzima bwo mu mutwe. Haraza kuba umwanya wo kubaza ibibazo. Wali, twatangira utubwira what is the theme of this conference?
The theme of this conference, Beauty, is Mental Health and Addiction Conference 2022. And without further ado, today we are very privileged to have experts who will be helping us to deliberate some issues and topics on this issue. But without further ado, let's call upon for the opening prayer from Pastor Francis Karasira to give us a word of prayer as we start the program. Pastor, may you take the stage so that you give us a word of prayer.
Yes.
Thank you. Let's give a round of applause to the pastor as he comes to the stage.
Reka dusenge. Nitwa Pastor Karasira Francis, uvuye muri ERC Masoro. Mwami, turagushima kubw'uyu munsi. Iki gikorwa kigiye kubera hano gifite agaciro cyane ku bana b'Abanyarwanda, cyane cyane urubyiruko. Turagusaba rero kugira ngo uduhe ubwenge, uduhe amaso n'ubushake bwo gukemura ikibazo kijyanye mwami n'ibiyobyabwenge, ikibazo kijyanye n'uburwayi bwo mu mutwe. Mwami Imana, turasaba kugira ngo tugire neza, tubone, tungurane ubwenge kandi tubashe gukemura iki kibazo kubw'imbaraga zawe, ubwa Yesu Kristo umucunguzi wacu dusenze. Amen.
Arakoze cyane Pasiteri kuturagiza Imana. Mbere ko dutangira, Wari, ndagira ngo nibutse abari muri iyi nama yuko iyi nama yateguwe n'umuryango Rwanda Youth Impact, n'umuryango utegamiye kuri leta ukorera hano mu Rwanda, ukorana n'urubyiruko ndetse na sosiyete nyarwanda muri rusange mu kurwanya ikoreshwa ry'ibiyobyabwenge ndetse n'ububata. Iyi nama kandi yatewe inkunga n'imiryango itandukanye, harimo ikigo cy'igihugu cy'ubuzima RBC, harimo HDI, harimo BDF, harimo Partners in Health, harimo n'umuryango n'ikigo cyo muri Turukiya gishinzwe kurwanya ibijyanye n'ububata. Wali, who is the first speaker?
Beauty, we are very privileged today to have the representative from RBC to give us the welcome remarks. And to do this, we are going to call upon Mr. Dynamo Naisenga to the stage. Thank you.
Good morning, Excellency Ambassador of Decade Rwanda, Bishop John, distinguished high-level delegates and speakers, audience, good morning. It's my pleasure to be here in an introduction meeting regarding the conference on mental health and addictions. This is a good opportunity for all of us to talk about on mental health and addictions, not only that, but also GBV cases and other related problems regarding mental health. The objective of this conference is to mobilize people on awareness campaign and policy interventions, as well as sharing best practices on tackling post-COVID mental health challenges, reducing stigma, discrimination and exclusion, and ensuring inclusive and affordable mental health care, welfare, empowerment, and individuals with mental health conditions. Addictions and neurodevelopmental disorders across the community and entire world have been several times on the debates. But for Rwanda, it's a good opportunity to host such kind of a conference whereby some rayers and all of us will be talking on strategies to overcome this kind of scourge. It is an opportunity of sharing best practices in stigma reduction, access to affordable and quality of mental health care, and how countries can eradicate all forms of stigma toward mental health. This conference is calling all layers in mental health to work together and to conduct regular opportunities to share achievement and discuss counter the challenge for durable solutions. Then, it is a time to rethink on mental health financing and investment, as none should be left behind in terms of eradication of all forms of stigma and discrimination toward mental health conditions. Collaborative and partnership in strengthening initiative to promote accessibility and accessible mental health care, including substance abuse-related disorders, are paramount. I think this comes as one of the matters to be discussed through this kind of good conferences. And advocacy for sustainable interventions require the partnership of everybody to accelerate mental well-being of people in need of mental health care. The government of Rwanda has done several interventions, but the government is not working alone. It is mandatory to work through this collaborative framework, including government institutions and the civil society organizations, like Rwanda Youth Impact, which is organizing this important conference. For us, it's one of the responses that we were waiting for this moment. Secondly, I'm calling all of us. Mentors have been struggling for having advocacy, understandable solutions, but today it's our time. Today it's our time to rethink on how we can invest and introduce a concept of financing in mental health. I thank you and wish you a fruitful conference and a good day. Thank you.
arakoze cyane bwana Dinamo turutse muri RBC ati leta y'u Rwanda ntabwo yigeze ireka kwita ku bijyanye n'ubuzima bwo mu mutwe ariko ntago ikora yonyine niyo mpamvu rero n'umuryango Rwanda Youth Impact nayo uri kugira uruhare rukomeye mu bijyanye n'ubuzima bwo mu mutwe.
Beauty, I'm so privileged to also recognize the partners who are making this conference a success. Who are our partners for this conference?
Abafatanyabikorwa b'inama harimo RBC, ikigo cy'igihugu cy'ubuzima RBC, harimo HDI, harimo Partners in Health, harimo BDF ndetse na Prison Fellowship.
We thank you so much. Let's give a round of applause to our partners for making this conference a success. We thank you so much, our partners, for this gesture. On the third speaker, we are very much honored Beauty, who is our third speaker. This third speaker is not new in the issues of health. May you introduce the third speaker for us?
Umuntu rero ugiye kugira icyo atubwira muri kano kanya ni Dr. Nyirinkwaya Jean Chrysostome, ni umuyobozi akaba nawe washinze ivuriro La Croix du Sud. Si byo gusa kuko ari na vice perezida w'ikigo Rwanda Youth Impact. Ikaze.
Let's give a round of applause as Dr. Nyirinkwaya is coming on stage. Thank you.
Maraho. Good morning, everybody. The representative of Minister of Health, Youth and Culture, the Ambassador of Turkey, the Director for Mental Health on RBC, and everybody. As the Vice Chairman of the Rwanda Youth Impact, it gives me a great pleasure to welcome you all to our first conference on mental health, on addiction and gender-based violence. According to reports from the Center for Disease Control and Prevention and on WHO, youth violence of drugs, intimate partner violence, child maltreatment as sexual and physical abuse, and mental disorders are preventable behaviors, but have negative effects on national rates of injuries and deaths, and on physical health condition. As a parent and medical practitioner, I have witnessed at my hospital so many cases of early pregnancies among teenagers girls, and each case came with its own complication for each young girls. These girls are in need of help, and together we need to come up with preventive measures to mitigate the challenges faced by our young people and society of Rwanda at large. Mental health, okay. Where is it? Where was it? Yes, sorry, I was, mental health and well-being are a right to everyone. COVID-19 has worsened the situation as records on teenage pregnancies and infection are quite high. Family conflict, high use of drugs, most of them have complications owing to the tender age of the young mothers. Rwanda Youth Impact, in collaboration with Rwanda Medical Center, welcome you to our first conference on mental health, addiction, and gender-based violence. Your presence here and your support mean a lot to us. To all our partners, we appreciate your presence and working with us to make this event a success. The theme of the conference will be mental health during COVID-19 pandemic, action, perspective, and sustainable solution to youth. The main purpose of this event is to strengthen the implementation of the strategies to promote well-being and healthier life by enlightening young people to stop using drug addiction to technology, but I think it's not only youth in this case. Alcohol, tobacco, and gambling. We also hope this conference will pave a way to starting sustainable project for the vulnerable group in Rwanda. So let me turn in Rwanda. Uyu munsi nk'uko mubibona hari abantu bato benshi bahari nk'uko mubyumva. Iyi conference igomba kureba ibijyanye n'urubyiruko. Donc biradushimishije kubona urubyiruko bwashoboye kubyitabira. Mudufashe, mutange ibitekerezo byanyu kuko ni mwebwe muzi ibyo bibazo kuturusha. Ni mwebwe mwigana n'abana n'abandi bana n'abandi bajene mumbawe kuvuga abana n'abandi n'urundi rubyiruko rufite ibyo bibazo. Ni mwebwe muri mu mashuri hamwe nabo, ni mwebwe muri hamwe nabo mu kazi, ni mwebwe mubana nabo. Donc muraturusha kwimenya. Burya urubyiruko muraziranye. Waba uri muri Nyamirambo, waba uri hehe, muraziranye. Ahantu bakora izo drugs, ahantu bafite tubona batanga kugenda banyerera, murababona, mubana nabo. Donc rero tugira ngo muze kudufasha kugira ngo iyi nama ivane umusaruro, tuhavane umusaruro. Murumva? Mudufasha kugira ngo natwe tuzabafasha. Murakoze. Umunsi mwiza.
Reka tumushimire cyane Dr Nyirinkwaya Jean Chrysostome ni Vice President w'umuryango Rwanda Youth Impact wari.
We thank you so much, Dr. Nyiriwai, for those wise opening remarks. Without further ado, ladies and gentlemen, we are so much privileged today. We have the guest of honor all the way from Turkey. He's representing Turkey in Rwanda. She's representing Turkey in Rwanda. Ambassador, Her Excellent Ambassador Shavik Bulchu. May you allow us to welcome here to the podium so that, let's give a round of applause, youth, as we welcome here to this podium. Thank you so much.
Ni ambasaderi wa Turukiya mu Rwanda. Ikaze, you are welcome.
Thank you very much. Oh, are you seeing me? I don't know. Good morning, everybody. I'm so sorry. Maybe I'm disappearing behind here, but you know, my heart is with you. So good morning. Moramutse. It's my privilege today to be with you in this mental health and addiction conference. And some of you might be thinking why the ambassador of Turkey is the guest of honor. If anyone knows Turkish Green Crescent Society, which is an NGO functional in Turkey, but also have extensive cooperation internationally, has established a cooperation with Rwanda Youth Impact, and it was just immediately before the COVID pandemic started in 2020, early 2020. They came here and we signed a cooperation memorandum of understanding between Turkish Green Crescent Society and Rwanda Youth Impact. And at that time, I remember we were talking about, you know, how we can cooperate in cooperation in the addiction prevention, drug abuse, all kinds of addiction and mental health issues, actually. Of course, I'm a diplomat. I'm not a specialist in mental health and addiction issues. But every economy needs healthy societies to prosper, to develop, to flourish. And healthy societies needs healthy people. And health today is a holistic issue. It's not just physical health, but mental health is equally important. And fight against addiction, all forms of addiction, is an important component of mental health. So I would like to congratulate the organizers of this conference, which I see is very, very timely, for pointing out the importance of mental health, especially in the, I don't want to say post-COVID, but we're almost post-COVID environment. COVID reminded us the importance of also the mental health. I'm sure not only in Rwanda, but also everywhere in the world, including my country, Turkey, there is an increasing trend of mental challenges, including addiction. And it's very important that all actors, all stakeholders involved in the struggle should work together. This includes government, this includes civil society, this includes faith-based institutions, this includes community leaders, this includes everyone. And also it has an important legal aspect that the government should also look at. That's why I find this conference very timely, very pertinent, and I would like to congratulate once more the organizers, including Mrs. Memory, who worked, I know, very hard to make it happen. But also the Rwandan government, the representatives of the Rwandan government here, who are also supporting this process. Without their assistance, of course, this is not existent at all, not possible at all. And equally, I would like to express my appreciation to all participants, the young colleagues here, who are interested in learning more about this struggle. And I really would like to wish everybody a successful conference without taking your time too much. I would like to thank you all and wish you a very nice day. Thank you.
Reka tumushimire cyane, ni ambasaderi wo muri Turukiya mu Rwanda, avuze yuko ari hano kuko ahagarariye ikigo cya International Federation of Green Crescent, ni ikigo cy'Abaturukiya gishinzwe ibintu byo kurwanya ububata. Avuga yuko ashimira abateguye iyi nama ndetse n'abayitabiriye kuko asanga iyi nama ari ingenzi, kuko buri wese ari uruhare rwe mu kurwanya ububata ubwo ari bwo bwose. Turabizi yuko habaho ububata butandukanye, hari ububata bw'iyobyabwenge, hari kuba imbata ya tekinoloji, smartphones, murabizi, internet ndetse n'urusimbi. Ni byinshi muraza kumva, byinshi bigiye kuvugirwa hano. Ni muri make yashimiraga buri wese witabiriye inama ndetse n'abayiteguye muri rusange.
Thank you so much, Ambassador. Once again, we thank you so much for your time and also support which you have given us in this very important time which we have together. Ladies and gentlemen, without further ado, we just want to have a closing remarks for this first session before we go to the tea break. And to do this beauty, we are honored to have the chairman of Prison Fellowship of Rwanda. And to close these remarks in a more dignified way, may we allow us to call Bishop John to the stage. Yes, Bishop John to the stage. Let's give a round of applause, youth. Let's give a round of applause as we give him this time.
Good morning, everyone. Your Excellency, the Ambassador of Turkey, as you say it in your language, Dr. Ngiringwaya, the Vice Chairperson of this noble organization, the organizers and everybody here present. Prison Fellowship Rwanda, which is an affiliate of Prison Fellowship International, takes the joy and the commitment to be in a partnership with these noble efforts because of the magnitude of the problem that we are faced with as a nation, and not only as a nation in Rwanda, but also as the continent, and a problem which is worldwide. The addiction and mental health, the GBV, and other detrimental attacks on our society, on our health, on our future, on our productivity, is engaging and earmarking and targeting our youth, which is our present and our future. I would therefore request everybody present, every member of this conference, and not only a member of the conference, but also every national of Rwanda, every category of the people of this nation, to put our hands together so that corporately we may engage, fight against, to reduce, but have long-lasting or lasting solutions to the problem. Sometimes we use the language which is a little bit more of discouraging or not determinative in a sense. We would really need to find a solution, a lasting solution to these attacks. Not managing them. We manage the effects, but we combat against the attacks. Therefore, our appeal, or my appeal, or our appeal as a corporate body would be to find a way to commit to the solutions of the problem. And this, as the ambassador said, we need a corporate approach to this, and not only scientists, not only the youth. Of course, the youth will take, I will implore our youth to take the lead because they are targeted. And the youth are present in the future. Sometimes we make mistakes and say our youth are the nation of tomorrow. It's not right. The youth are part of the nation, are the nation today, and continue to be tomorrow and in time to come. Therefore, we need to have a healthy youth. But most of the generations, if we increase mental illness or mental defects in the youth, we increase the effects of the GBVs and the children from abuses who are also a target of stigmatization, which we need also to fight against. So therefore, we need to engage corporately, but have the youth into the leadership of this in order to eliminate this. And be able also to get the contradictions of our way. So we need a healthy young men and women. We need a healthy nation, and having a healthy nation and healthy youth will automatically reflect on our economy and other systems of our nation. I would therefore request that in the discussions and this conference, we get real engaging and transforming resolutions. And that the planners thereafter will find programs to engage these resolutions into effect and results. I just want to thank you, and I pray that God will continue to give us the energy and wisdom to bring our nations and our continent to good health. Thank you.
Reka twongere tumushimire cyane Bishop John Rucyahana. avuze ko ibibazo byo mu mutwe ndetse n'ububata byugarije ngo umubare munini w'urubyiruko, kandi urubyiruko ari rwo hazaza h'igihugu cyacu. Asaba buri wese kumva yuko ari inshingano ze mu gushakira hamwe igisubizo kuri ibi bibazo. Avuga yuko hakenewe ubufatanye mu guhangana nabyo. Avuga yuko nta kigo runaka bireba cyonyine, ahubwo hakenewe ubufatanye bwa buri wese. Avuga yuko hakenewe urubyiruko ruzima, ruzira ububata, ruzira ibibazo bitandukanye, guterwa inda z'imburagihe n'ibindi bitandukanye. Wali, what's next?
We are so much privileged. So as we conclude this session, we are very thankful for the first speakers and who did the opening remarks and closing remarks, not forgetting Her Excellency Ambassador from, for Turkey in Rwanda. So we want to thank you, everybody. Let's give a round of applause for this first session, and as we want to go to the tea break. Let's give a round of applause to the first session. So on this note, I'm just being told, because of the tight program of our ambassador, we might request, since this is a first and historic conference of Rwanda Youth Impact, which is organizing mental health and addiction conference, we request through the podium our ambassador, maybe a group photo with the dignitaries who are here. The youth wants to have just one group photo, if it's allowed through the diplomatic protocols, I don't know. But we would like you to come on stage, Dr. Nyiriwai to come on stage, and all the speakers, Bishop, can you come? We just want the youth. I also want you to come at the back here so that we have a group photo. All the youth, but the dignitaries can come on front. We want to have a historic photo. I think also President Kagame will be happy, he will be happy to see this photo. This is historic. So all the dignitaries come front. The youth, can you come at the back here or the stage so that we get a photo? All the youth and all the dignitaries, the partners of this conference, BDF, partners of health, can you come also front near the ambassador? We want to have this group photo. All the partners, BDF, HDI, Prison Fellowship, all the partners. This photo is for everyone. So the youth go on top here. The partners go on front. We are just humbly requesting your presence in this group photo. We want every youth to have this photo in his home. Go at the back. We want the partners, can you come? And all the invited guests, dignitaries, we want to have this group photo. This is going to be an historic. I will need it in my home. I will really need this photo in my home. The partners, you go on front. Youth, come. Can you come here on top here, youth? The partners on front with the dignitaries, the cameramen will help us also to. So to those who are not Warefu, it's a challenge, but we'll just tell you that you are somewhere there. This is a historic photo. I hope everybody is there, and we'll say the cameraman will also take another aerial shot when he is going to jump on top of the chair, so that also the youth, whether from 3 districts, to appear. So as we take the photo, we can say cheese. It's an honor for us to have this photo.
Tugerageze twese guseka mu ifoto kugira ngo izikeye.
Let's not be very serious, guys. Let's smile. Is it okay? Let's give a round of applause to the cameraman and all those people. So we want now to go to the tea break. On the time of tea break is a time beauty, is a time to network, know each other. We are going to come back here exactly at 10 o'clock. So the tea is going to be served here. I think, let me go. Lemigo team are going to lead us, but the first is the dignitaries to go on the tea, the ambassadors, the speakers. Then once the dignitaries get their tea break, then the rest of the youth, we can join them. Are you happy, the youth? Ask them in Kinyarwanda.
Ese murishimye urubyiruko murishimye aka ni akanyero ko kakaruhuko gatoya k'iminota 20 gusa tugiye gusangira icyayi tuganire tubonereho akanya ko kuganira aho duturuka tumenyane kurushaho gahunda dufite intego zacu mu minota 20 gusa hanyuma dise tugaruka dukomeze n'izindi gahunda murakoze.